Hello, and thank you for joining me. It is Jen with Aging Advantage. Today, we're going to continue with our second part of our series about medical gaslighting. And yes, this is a topic that absolutely needs to be discussed. And unfortunately, it's not discussed enough on our side of the fence, on the medical side, I don't think. And so it happens, though, far too often, as many of you know, on your side, unfortunately. And, so I just want to bring, light to this conversation and help you all to really recognize again. And this is what we're going to be talking about in the second part, really again, like recognizing what is medical gaslighting. We discussed this in the first presentation. So go back and listen to that one if you haven't yet, either before or after this one. But medical gaslighting again is really, if you think about it, is really like you trying to share with somebody on your medical journey, like a doctor or a nurse, somebody, what's going on with you and your health and concerns you have, things that you're experiencing, etc. And you just being completely like dismissed or like rushed, or again, you get constantly put on the lovely, what I like to lovingly call the, oh, we're just going to wait and see list. Oh, we're just going to watch it and see list. And lovely question mark? No, not great, because over time, you're just sometimes watching and seeing yourself literally go from like pre whatever the condition is, to, well, now you're kind of stage one, stage two, stage three. So, oh, now finally, when someone pays attention to you and like takes you for real, what you're actually saying at face value, sometimes then by the time you get actually diagnosed and treated, good grief, you're already in stage three, stage four, or for that matter, sometimes like end stage something before you can actually get somebody to pay attention to you, which is not right. And so that's today what we're going to be talking about really now is like the second piece to all this is recognizing what it is. Like, what are those words that you're going to be hearing coming back at you, as the patient, you're sharing your experience. What are those things and those phrases and kind of those behaviors that people might be doing towards you? For again, you to know, like, okay, wait a minute, something's not right here. Yeah, this is probably that whole medical gaslighting thing that Dr. Jen told us about, and not good, So the second part of today's presentation then is helping you guys also then next to understand, okay, so we've unfortunately recognized this is what's going on, but what do we actually do about it? What are the resources that we have? And who are people that can help us to continue to push forward and for us to continue to seek appropriate types of care? And that is what we're going to be diving in today, and then ultimately wrapping all that together, putting a bow on top of it. How do we like move forward? How do we actually get these things and these initiatives going? So again, today, that's what we're going to be all talking about. So thank you for joining me. And again, Jen with Aging Advantage. So Aging Advantage is a nonprofit. We are based here in the St. Louis area, and we serve St. Louis and the surrounding area. And we are able to do that through grants and donations and partnering with incredible organizations here locally, and also some, larger nationwide type of initiatives as well. And we're able to provide you all with really just incredible educational opportunities and learning experiences like this to help you grow and to help you have more tools in your toolbox to know how to better take care of yourself, take care of people that you're caring for, potentially around a lot of different topics. Obviously health topics for sure, because we got to have our health or we don't have anything else, right? But also, housing issues, food insecurity issues, issues as well, like of isolation, trying to help you all, as I always joke, help you all get out there in the wild and be more social and, really live like more fulfilled, purposeful, happy, healthy lives as well. And ultimately, at the end of the day, also, I want you guys to just be, empowered, more confident, and also really learn. And this is one of these kind of topics too. I really want you guys to learn how to advocate for yourselves. I want you to be able to feel confident, being more self-reliant and self-resilient as you're navigating all these different types of things that happen. And especially as we age, or if we're somebody also too that is a disabled person. So these things are all super important, and so I'm glad that you all are joining me today. And again, as always, get comfy, get cozy, relax, and just kind of take all this information in today. Maybe grab a pen and a piece of paper so you can write some stuff down if you need, but grab what you're drinking and let's get started, guys. Okay. So again, today we're going to be really going through how do we recognize if we have medical gaslighting going on again in our world. So with that being said, we're going to first dive into, again, like I said, just some of these key phrases that I want you all to be listening for and watching for, just from a pattern standpoint as well. And sometimes, again, it's not always going to be like the first time you meet with someone, always, like, yeah, they kind of might brush you off or they kind of might dismiss you. But if you've now brought this up like a couple times and they're still not getting it and they're still not paying attention, super duper red flag. So let's go through some of these for you guys here. All right. Okay. What are some of these phrases and some of these things that you might be told or that you might feel and that you might experience? So one of the first signs in again, key things that you're going to be looking for is that you feel like really it's all in your head, or somebody is going to tell you, oh yeah, no, like that's just what you're thinking. That's just what you're thinking. You're not the doctor, just it's all in your head. And this is really kind of the most unfortunate direct form of actual gaslighting, because being told that your symptoms are imagined or, again, like exaggerated, or that your pain is now like just psychological, that's it, without, mind you, having anybody order or do proper evaluations on you, or proper like testing or like clinical evidence to support that actual diagnosis, or claim that they're making, can be so super duper frustrating. And again, I just want to say here and pause here for a second, because that connection between mental and physical health is very real. And psychological factors can absolutely affect physical symptoms. That can 100% be a thing, and that is legitimate medicine at the end of the day. But however, there are meaningful differences between a provider who does a thorough evaluation, thorough diagnostics, thorough testing, and all the things, and then thoughtfully discussing all those things with you, and again about the mind body connection with you, and a provider who just defaults automatically, as soon as you bring something up, they automatically default to psychological explanations as a way of ending the conversation and just hurrying up, shutting it down, and getting it over with without doing any kind of proper investigation whatsoever into your condition, evaluating things at all. One is the first one, if you will, is good kind of care. And that's what we want, somebody listening to you, evaluating things, checking it all out. And the second one is dismissal and not right, not fair, not appropriate medically. So if the provider suggests that your symptoms are stress related or anxiety driven, it is completely, and it can be the case. Like there are a lot of people also nowadays, please know, there are a lot of people, and fairly enough, because of all the things, post COVID and in going through COVID, post COVID, the job market, here in St. Louis, as a lot of that are living, in our area that are listening to this, we went through a fairly significant, tornado event downtown about a year and a half ago at this point, a little over a year ago. And so, yes, fair. We have a lot of stress and we have a lot of anxiety. So, if the provider suggests that your symptoms are that, it's completely appropriate on your end to ask the provider back, what tests or evaluations have been done to rule out any other potential causes? Or what would we need to see, or what kind of tests would we need to do possibly to explore any other kinds of explanations or considerations before you just kind of stop, if you will, at, oh no, it's only anxiety or it's only just stress that's actually happening. And that's totally fair. Again, that's a write it down moment. You have the right to ask that because, I always tell people at the end of the day, like, yes, like I might be the doctor, or, yes, that nurse might be the nurse, or that is, like the CNA, like the medical assistant, whoever, right? Whoever you're working with on the medical side, yes, they might be the medical person, but at the end of the day, guys, remember, like, we work for you. I'm going to say that again for the people in the back. We all are supposed to be at least on team you. We are here to support you, not the other way around, right? So you have every single right to ask these questions. It's like you're helping us really to guide your care. And so it's totally appropriate to ask, like, okay, well, is there any other tests? Again, evaluations, clinical, clinical things that we need to do to like rule these other things or anything else for that matter out before you just kind of stop and say, oh, yep, this is what it is. It's psychological, anxiety driven, stress related. That's it. And again, those are also fair, diagnoses then that would go, to a different type of doctor. It would go to like a psychologist or psychiatrist or something like that. And then you would kind of journey down that path as well, potentially for support. But totally fair to ask these questions. Again, we work for you. Remember that. So, another thing on here as well, being blamed for your condition. So, what this looks like. So, this happens when a provider attributes your illness or symptoms to your lifestyle choices or personal failings, again, without clinical evidence to support that connection. And in a way that shifts responsibility away from proper diagnosis and care on their part. What you might hear. You might hear things like, if you just lost some weight, this would improve all this. Or you just need to manage your stress better. Delivered not as part of like an actual overall comprehensive plan that they fully put together that has other puzzle pieces to it, but just as a way of like closing the conversation, stopping the conversation and kind of cutting you off and them dismissing you and kind of moving on. So again, lifestyle does absolutely affect your health. And we talk about all those great, awesome educational opportunities on this channel all the time. I share all kinds of really neat things with you guys for you guys to be able to better your own, lives and lifestyles, etc. And again, sometimes those conversations are important and totally appropriate. But when lifestyle blame, though, is used as a substitute, and this is the problem here. So when they just blame your lifestyle as a substitute for them not doing further investigation like they should be doing, and supplementing it that way, something has gone wrong. And, and again, not right, not what should be happening. So, repeated dismissal. This is the pattern where your concerns are consistently being brushed aside. So, even as your symptoms like worsen over time, they're not giving you any referrals. They're not doing any further testing. They're not doing any meaningful follow-up, and they're not offering to have you do follow-up appointments or follow-up blood work or follow-up anything. And if you have raised the same concern multiple times and it still isn't being investigated at all, this is a pattern worth paying attention to. A good provider is going to take worsening or persistent, you bring it up again and again and again, symptoms as a signal that they need to dig deeper, and they should dig deeper. Repeated dismissal is a sign that it may be time to seek care elsewhere with a different provider. Again, get a second opinion, heck, get a third opinion. Have somebody else look at your situation and get a new set of eyeballs and ears, and a new medical team looking at what you have going on. Another one is going to be doubting your own experience. And this might be like the most, I would say, I don't know, the concerning kind of one at all. Because, it can be hard to recognize really from the inside. So when you leave appointments feeling just confused, like more confused than when you went in, invalidated or unsure of even your own perceptions, like you start then wondering like, am I actually, maybe I'm actually just overreacting. Maybe again, like maybe I'm just being a little extra. Maybe I am exaggerating this thing. Maybe my pain, really isn't a 7 out of 10. Maybe it's actually only a 3 out of 10. Like maybe it's not that bad. Whatever, pick a body part, whatever body part it is that you're having issues with. Maybe like, you start then wondering again, if you're just kind of a little being dramatic, a little overreactive, maybe you're just getting old. But all of these things really is a key sign that your legitimate concerns aren't being taken seriously. So here's something I want you to hold on to. If you have lived in your body as long as you have lived in your body, which is your whole entire lifetime, however old you are, you know your body better than anyone else. And again, you know what feels wrong when something feels wrong. Like, way ahead of time when you're going to start getting sick, right? When things just don't feel right or when something has changed. And that knowledge that you have, since you are an expert about you, that knowledge deserves respect. And it's not proof of a diagnosis, but it is absolutely a valid reason to seek real evaluation and to have them continue to evaluate things until they can conclusively say, yes, I'm going to diagnose you with this, and this is the kind of path and plan and of treatment that we're going to try to put in place, or we've checked all the tests, we've checked all the boxes, we've done all the evaluations, and I don't know why this is going on yet. But we're going to recheck all these things again in a couple of months and see where we're at then. So again, somebody has to respect the fact that you know what you're talking about because it's your body. Back to we work for you. Remember that. Write that down. Yeah, no, we work for you. So, it's something that you have to trust. And just don't let anybody talk you out of it. Again, you know your body and you know what's right and you know what's wrong. Now, let's talk about what you can actually do because knowledge is only powerful when it leads to action. And there are very concrete physical steps that you can take to advocate for yourself in medical settings. One of the things here that is really important is there are a lot of powerful tools available to you, and it costs nothing. So you need to make sure you document your symptoms, their frequency, their severity, when they occur, and what makes them better or worse. That is going to be, just a key starting point. And, again, like write those down. So I'm going to kind of go through that again. You're going to need to, again, just write down, and maybe you keep notes in your phone. Maybe you might put it on like a medical app or something. Maybe you just write it down in a little journal, but you got to document your symptoms again. So their frequency, like how often are they happening? The severity, like a lot of times, again, in medical land, we use the 0 to 10 scale we throw at you guys all the time. 0 being no pain or no issues, 10 being, like if you say 10 out of 10, that means like you're dying, or it feels like you're dying. And so, somewhere along that, or maybe sometimes we'll use the mild, moderate, severe, something like that. And so that'd be kind of the severity then part two. But like, when do they occur? Does it occur like very first thing in the morning? Like sometimes we'll call this timing. So does it occur first thing in the morning? Does it only occur after you eat? Does it only occur, after you drink coffee, after you're standing up for a really long time, after you're trying to go from, sitting to standing fast? Like when does it flare up, I guess I would say. Also, things to write down too is like what makes it better or what makes it worse. So sometimes we'll call this like provocative, things. So like what makes it, what irritates it, what makes it worse. And that could be, again, when you like stand up and you walk around for a really long time, your hip hurts really bad, your knee hurts really bad. What would be something that would make it better? Maybe like when you sit down, might make it better, for an example. So you want to write these things down for your actual condition, what you're experiencing. But then next step, you want to write down every interaction that you have with your healthcare providers. So take that same little notebook, and when you go in and you meet with these healthcare providers, take notes. Write down who the provider was that you saw, what's the date, what things you brought up as concerns, and what the doctor said or the provider said, what was recommended, or also if they told you, for the what was recommended, sometimes there's also like a what do they do not recommend list. So maybe that would be like they recommend for you only to be drinking water, like don't drink acidic, acidic drinks, don't drink coffee, don't drink orange juice, whatever, just whatever it's going to be, right? You write those two things down. Another thing that is really, really key here that I love, and it's so helpful when patients come in with this information for us in medical care land. I always jokingly call it like a pre-call plan or a pre-visit plan, but it's helpful if you do one. So what does that mean? also on this piece of paper, write your symptoms down and all the things like we talked about. But then next steps 2.0, you're going to write down your, top five or whatever, just write down all of them for that matter, all your different concerns that you have medically, like going on, and then questions that you want to ask the doctor or that provider about. Maybe you have, a question about, again, like should you be doing this? Should you not be doing this kind of a scenario? Or you're going on this trip coming up. Is that really a good idea? Or is that not a good idea? Maybe for whatever condition you have going on with your body, you're looking at new jobs. And so you're trying to decide, would something like a desk job be better? Or for whatever condition you have going on, is it okay for you to do like an outdoor landscaping kind of a thing, where you're a lot more active, etc. So just know, like, there's a lot of different components to care that you can ask the care teams about that a lot of people just don't. Another great question sometimes is, would it be helpful for me to talk to a nutritionist? Like, is there any lifestyle components, getting more exercise, or like what things can I control or what things can I do as the patient to help make this better? What things, again, do you absolutely not want me doing that is going to make this, condition potentially worse? And those, sometimes again are questions that have nothing to do with medication, have nothing to do with surgery, have nothing to do with any of that, but just have to do with kind of lifestyle modifications that you have control over as the patient. And we love those kind of things. We love having you be a part of your medical, journey, and helping also to take ownership over, your outcomes again that you can control. Because again, we work together as a team, us and you guys, to help you get better care and better results and better outcomes. So make sure you are, asking those kinds of questions. And again, nowadays, a lot of different systems, medical systems, they have nutritionists, they have lifestyle management people, they have weight management people, they have all kinds of different types of people, again, social workers, care managers, case managers, like all kinds of people that they can, deploy and help you navigate some of all these different types of conversations that you might need. So absolutely, beautiful. So why does this whole record keeping thing matter? And it matters because clear factual record does several things. So first, it helps you communicate more effectively. So instead of you trying to remember and describe your symptoms in that moment under pressure in a short appointment, you have notes you can just read and refer right to so you don't forget something. Second, it also creates accountability. So when there's a written record of what was said, and if something was dismissed, then it becomes harder to simply pretend those concerns were never raised. Third, it demonstrates to the provider that you are an engaged, serious patient who has been paying attention. And that, I will tell you, will absolutely shift the dynamic in the room, because that doctor knows, or that medical staff knows that you're on it and you're paying attention and you're not going to be dismissed. So they know they have to step it up and they need to do it right. And that's huge. And that's key, guys. You don't need anything fancy for this. Again, just a small little notebook dedicated to your health records is beneficial. Again, some people use the Notes app, but just consistency is key. Bring support. This is a good one. So you do not have to face your medical appointments alone. And for many people, having like a trusted person with them can make a significant difference, especially, if you are older and have a harder time remembering all the things, or maybe your handwriting isn't that great for you to be able to write some of these things down. Same thing, if like you're a disabled person or something, especially, but yeah, always, bring somebody with you if it's helpful. And also, they can help speak up on your behalf too when you are forgetting to say something. Sometimes it's great too because they can be another set of eyes and ears. They can listen and they can ask really great, like, follow-up questions. And I think that is really, really helpful as well. So sometimes, things you might forget to ask, and that's just, simply by them being there. If you don't have someone who can accompany you in person, some providers will allow a support person to join by phone. So you can like call them nowadays, like on your cell phone, and add in, a child maybe that lives in another state, if you're, a senior, to support you in those conversations, or vice versa, etc. But it's worth asking, and we'll just talk about that in a little bit of a moment. But a lot of times, having another kind of support in these kind of individual moments where somebody can kind of feel vulnerable, can be absolutely invaluable for all of you. Another thing here is to seek second opinions, and then advocate for yourself, as well as looking at, different kinds of support resources that you have access to that can help you in these kinds of moments and help you then really to figure out how to take some of these next steps and how to move forward. Like now that we know, okay, what are we going to start doing next? How do we like say it back now that we know what we need to do for the plan? How do we say it? How do we really advocate better? And then again, who are those types of other providers besides bringing, somebody with us, which is an incredible resource and support to the appointments, adding somebody on the phone. Again, having that person who is, a trusted person in our life help us to do what I lovingly called kind of the pre-call plan, right? Or the pre-visit plan, writing those things down on paper, your concerns, your questions, getting those things like documented, what was discussed, what was dismissed, what was, ordered for next kind of tests, etc. Because sometimes also, and this can absolutely happen, the provider will actually order a test or want you to do a follow-up appointment and do a referral. They'll maybe even put in a referral for somebody else, like, a certain specialty. And then unfortunately, like the referral just gets lost in never, never computer land, or you just get lost and stuck on a list somewhere, and they just don't ever like follow through and get you connected from the doctor's appointment to the actual like schedule the test to get it done, so that the doctor can get the results back and create the right kind of plan for you. So sometimes it's not necessarily that the doctor or the provider is quote unquote gaslighting you. Sometimes it's that those dots just aren't getting connected. And so that's where writing these things down is key, because then and you remember, yeah, I was supposed to get an x-ray, but it's been a week and I haven't heard from anyone yet. Or, it's been 2 weeks. Good grief. Like, let's hope it's not that long. But these are the things that were supposed to happen, and they haven't happened yet. So you can call the provider back and you can follow up and keep things moving yourself. So in the last series of this workshop, we're going to look at, again, just what are the words, even more kind of phrases, right? And words that you can use to advocate for yourself or a loved one. And then also, again, like, who are these care managers, or who are these different people that are attached to doctors' offices nowadays as well? Like I alluded to in this video a little bit, there are, like I said, case managers, care managers, social workers, etc. There's a whole host of people that can be deployed to help support you. But I kind of want to go over a little bit more and dig a little bit deeper into what are their roles, Because a lot of times we hear their, kind of hear the titles getting like thrown around everywhere, but like, who are they and what do they actually do? And how can they help? And how can they help you kind of move everything forward? So we are going to talk about that in the third one and final one for this series. So thank you all for joining me today. And again, if you find this helpful, please share this with other people, even if they're not here in the St. Louis area. And definitely, like and follow us on Facebook and subscribe to the YouTube channel so that you don't miss incredible content that is really helpful and really meaningful for a lot of you like this. And as well, I always encourage you guys, to comment and share with a community, that we're building, like what has worked for you and your family in this area? Like what have you found success in so that we can really all like support and uplift each other to help us build our confidence in all these different areas with all of our success leaves clues moments. So again, thank you guys for joining me, and we will see you in the third and final one for this series. Thanks.